Hi, I'm Jonah Essers with the Tummy Handbook. Welcome back to my series of videos on food allergies in infants and toddlers. In our first video, we discussed what the biology of a food allergy is, and we broke down some of the terminology. Now we're going to get into the specifics of what exactly a food allergy looks like in children. And every day in my office, I get a family that gives me a sign or symptom and that they're wondering if it's due to a food allergy. And our children are changing right before our very eyes. We have lots of opportunities to see something that looks a little strange, and it's very common to wonder, could this be due to something in my child's diet? So let's break down the list of signs and symptoms of a food allergy that you need to pay attention to, and we'll also discuss some of the things that are probably not related to food allergy. So the first category is around immediate, potentially life-threatening, really dramatic reactions. And in my first video, we discussed the concept of an IgE food allergy. You can watch video number 1 to learn a little bit more about that. And in these immediate reactions that potentially happen within minutes to up to 2 hours after an exposure to food, we see a whole array of potentially concerning symptoms. Number 1, we see breathing issues like wheezing or cough or labored breathing. Number 2, we see signs of shock, so going pale, lethargic, listless, or limp. Number 3, we would see hives and eruption of a rash in the skin. They look like little wheals with redness and bumps that are itchy. Number 4, we see drooling, which would be a sign of swelling in the mouth. And number 5, we might see really dramatic gastrointestinal symptoms like excessive vomiting or abdominal pain. If you're having these symptoms, you definitely want to seek medical attention. And whether that's you speak directly with your primary care doctor, or you're going to the emergency room, or you're picking up the phone and calling 911. And you'll probably want to establish care with an allergist who will be the one that will help figure out what foods you might be allergic to and give you a medical action plan going forward. After these immediate dramatic reactions, we head into a whole array of signs and symptoms that are more delayed in onset and are usually more subtle and hard to know what you're looking at. The first would be blood and mucus in the stool. This is probably the most specific sign of a food allergy in an infant and potentially a toddler. We see streaks of mucus and potentially flecks or streaks of blood mixed into the stool. And it usually reflects a rash or inflammation inside of the bowels, and that weeps into the poop and makes it look like blood and mucus. It's very scary looking, but it's usually not a lot of blood loss. People do visit the emergency room because when you see blood in your baby's diaper, it's certainly concerning, but it's usually not a medical emergency. After blood and mucus in the stool, I think about eczema. Eczema is a red, itchy, scaly rash, usually in the folds or the creases of your baby. It tends to flare up and down slowly over days to weeks with chronic exposure to something. Usually it's a food, but it doesn't have to be. It could be something like a detergent or something in the environment. After eczema, I think about vomiting or spit ups, and this is a really tricky one. Lots of babies spit up and vomit. So how are you supposed to tell the difference? The reality is you can't. Vomiting and spit up from allergy and vomiting and spit up from regular baby spit ups often look the same. So if it is allergic, it's usually because you have swelling or inflammation inside of the esophagus or the stomach, which leads to the spit ups or the vomit. The symptoms should really be taken into context. If it's really the only sign, you want to talk to your primary care doc about whether there could be another reason for the vomiting or the spit ups. However, if it's happening in the setting of a rash or characteristically after a certain type of food, it probably is related to a food allergy. Definitely have this discussion with your primary care doctor. After vomiting and spit ups, I think about constipation and diarrhea. Again, this is a tricky area. Lots of babies have diarrhea and constipation. Going 5 to 10 days without a bowel movement can be a sign of allergy, and it's definitely something to consider with your primary care doctor. Diarrhea, if there's a major change from the baseline, like your baby has a doubling in the frequency of the diarrhea, or it comes with a lot of pain and cramping, potentially with poops in the middle of the night while your baby is sleeping, especially if there's mucus and blood in the stool, those potentially could be signs of allergy. Next, I think about poor weight gain or failure to thrive. And again, there are a lot of reasons for babies to lose weight or to not gain weight appropriately. One of them would be food allergy. If there's inflammation inside of the gastrointestinal tract, it often might be hard to absorb nutrition. And you definitely want to have that conversation with your doctor because you don't want to DIY at home whether your baby is losing weight. You really want to plot the growth on a proper growth curve. Your primary care doctor is trained to know whether your child is meeting their growth requirements, and they want to look at these data points on a curve to know whether there should be concern or not. And lastly, I think about progressive trouble with feeding. And again, this can be tricky because lots of babies and toddlers are picky eaters, which would not be allergy. However, some babies have enough inflammation, swelling, or discomfort in their intestinal tract that they simply lose interest and desire to eat. You might need to be paired with a dietitian. There might be changes to the mother who is breastfeeding, or to the formula, or to the table food that your baby is eating. So now that we've covered the major and important signs and symptoms of a food allergy in an infant and a toddler, I'd like to contrast that with a few soft signs that are probably not related to food allergy. So I hear regularly concerns about bloating, gassiness, fussiness, trouble sleeping, and hiccups or burping. And in isolation, these signs are not really in keeping with a food allergy. And so I would really discourage removing foods or making a dietary change just for those soft signs. Again, that should be taken into context. If you're seeing it with other harder signs of allergies, like the ones that we just discussed, they may be important. However, please take that with a grain of salt. So in summary, immediate reactions with hives, breathing issues, signs of shock, get immediate care. Seek attention from a primary care doctor, emergency room, and probably you'll need to establish with an allergist. Many infants have delayed, more subtle reactions that turn up over time. They're less scary, but they're much harder to track. So zoom out on the history of your baby over several days to weeks of what you've offered that child so that we can see whether food is potentially causing the problem. Next, you can really count on mucus, blood in the stool, a characteristic rash after the same exposure of food as signs of food allergy. Other signs and symptoms have to be taken into context and should really be placed with a larger story around other signs and symptoms of food allergy. Thanks for listening. Please visit my YouTube page so that you can send me a comment and let me know what you think of this video and what I can be doing for you with other future videos. You can also visit my Instagram account and I'll have the links below. Thanks so much.